Welcome everybody to Make It Make Sense with Monique Pressley. I'm your host, Monique Pressley. Thank you so much, as always, for joining. We have a great show planned for you today. As always, we want to assure you that when you come in this space, we are going to give you the facts. We're dialing down the noise, the rhetoric, the bickering back and forth to give you the who, what, where, when, why. And even when there's commentary, it's going to be based in facts and based in data. We are doing our best to bring you the topics that we need to make sense, because sometimes we're watching the news and we don't know up from down and down from up. And frankly, I think that they plan it that way to keep us watching, but we think less is more, right? So we spend this 30 minutes or less giving you exactly what you need, which is the truth, the facts, the information that can arm you to live better, more quality lives. I want to remind you, for those of you who are not yet following me on YouTube, subscribed to my YouTube channel. It's Monique Pressley TV. Please do that, because that is where all the full episodes of our show are based now. When we first started, we were putting them on the feed. They're not there anymore, I know, but click on over to YouTube and you can see everything that our production team is working on to make the best possible product for you. Also, support our show, please, and our content. If you're coming here and getting content you like, support us. My Cash App is MoPress. Go to the link tree in my bio to get more information about other ways you can support through Business PayPal, through Patreon. And finally, we have a great topic today, but I want to point out I'm wearing blue. I always have on something blue in the month of April because it is World Autism Month. You know that subject is near and dear to me. I am a mom of a child on the spectrum, and I am an advocate for all those who are going through similar struggles, and hopefully to make the road easier for those who are coming behind me. So keep lighting it up blue all month. We've got a great show this week planned for autism with our special guest, Ariva Martin. That'll be on Friday. But for today, let's talk about a topic that is not unrelated. This week is Black Maternal Health Week. And as some of you may know, the issues for Black women in maternal health are unfortunately plentiful. We find that Black women are 3 or 4 times more likely to die in childbirth than our white counterparts. We find that there is an issue of lack of access to health care for Black women. And we find, as Dr. Sharon Malone told us, OBGYN, who was my OBGYN, wife of our former U.S. Attorney General Eric Holder, who now is starting up a whole new project in order to get women the maternal and menopausal help that they need. She told us we're not listened to, that our concerns don't matter. So I've got a supreme expert to talk to us about all those things. Dr. Rachel Villanueva. She is the president of the National Medical Association. She's also an assistant professor of medicine in obstetrics and gynecology at NYU. And today, we've seen her everywhere. We've seen her CNN, we've seen her MSNBC, Rachel Maddow, Cuomo Primetime, you name it. But she's here with us today. So it's my joy to welcome her to Make It Make Sense. Hi, greetings.
How are you?
I'm doing well now that you're here, because I know that me and everybody who's going to see this is going to really get the news that they can use in such just an important week where we try to bring awareness around Black maternal health issues. And I know that you are currently president of the National Medical Association. For those who don't know the importance of the NMA, can you please tell us?
Sure, I'd be happy to. Thanks so much for having me today. The NMA was founded in 1895, and it represents Black physicians and patients across the country. We have a very long history of supporting health equity and access in our communities. And we were founded at a time when physicians could not Black physicians could not practice in majority organizations. So American Medical Association wouldn't give us privileges. So we couldn't practice in our communities and take care of our patients. So we do what Black folks always do. We created our own organization. We created our own hospitals and medical schools and took care of our patients and communities. And that's really what we continue to do today. There are NMA doctors throughout the country. We have a national organization. We have local societies. So there's an NMA physician taking care of you. You might not even know that that person is part of the NMA, but very likely if they're a Black physician, they are.
Yes, I mean, and you are so right. We do what we have to do in order to, I mean, that is our history, that's our legacy. We turn the challenges and the setbacks into opportunities to provide more. And now the NMA really is on the front line. I mean, I see you and those who came before you as president are the ones who are go-to experts for subjects around our health. And I watched several of your interviews that you did around COVID and the need for the vaccines and the need for COVID care for our people. Right. So just thank you so much for all the work that you do. But I know that this week is in your sweet spot because you're not just president of NMA, but you are an expert in the OBGYN land. So tell us, what is Black Maternal Health Week and why do we need one?
Well, you know, it really is amazing. But Black Maternal Health Week was started, I think this is the fifth year. And it was started because of the statistics that you just mentioned, that Black women are dying in this country at a disproportionate rate. I mean, we have to just say even before that women in the United States have one of the worst maternal care of all industrialized nations in the world. So it is terrible for women in general in the United States, and particularly for Black women in the United States. The statistic, 3 to 4 times more likely to die. I'm in New York. The statistic in New York City is 8 to 9 times the rate. It does not, you know, people like to say, oh, maybe they're not taking care of themselves. Maybe they're not educated. They don't know what they're talking about. They like to use that narrative. Yeah. Whatever your socioeconomic status is, we're dying at a higher rate. Black college educated women dying at a higher rate. So it has really nothing to do with those things that people like to tell us are our fault or we're not doing well enough. And really, we know there is a system, our healthcare system has a lot of bias, implicit bias in it. People come in with preconceived notions about whether you're keeping yourself healthy, what type of person you are. And that really has affected the care of Black people since the beginning of time, really. Yeah. I mean, these kind of statistics are not new in general for Black people. We know that Black individuals suffer in our healthcare system. We get treated just because of our race, get treated more poorly, and have poor health outcomes. Yeah. So this is really an issue across the board that we need to deal with, and at the NMA is at the forefront of what we try to address, but particularly for Black women. And this week is a week to highlight that. I think it's really incredible to think that we are actually nationally speaking about this, because for so long, these are not new statistics. Right. These are not new statistics at all. And so for very long, we've known it, and kind of just the healthcare system just was like, well, that's the way it is. But now we're really putting a spotlight on it and making change. And even you can see the administration, our president, our vice president, this is a priority for her, is Black maternal health. A priority for the administration is making sure that legislation gets passed that supports all of the things that affect Black maternal health, not really just what happens in the hospital, but those things that happen outside of the hospital, those social determinants of health, how we get access to the hospital, but our mental health care, research around Black women, access to increasing maternal health care workforce, so doulas, midwives, all the entire team that can help support Black women and women in general who are birthing. But so we see that now it's a national priority.
Well, I definitely I wanted to definitely unpack some of what the administration did just a few days ago in terms of the executive orders. But here's my question, because I hear you and others saying in terms of us being listened to, that frankly we're not. And the story I told last night when I was prepping everybody and telling them that you were going to be on here was, you can be a poor teen unwed mom to be, or you can be Serena Williams, and
That's
you
right.
cannot be heard. You
That's right.
cannot be heard. You can be, completely in charge of saving your own life because you're listening to your own body. So we know that we have that part where you're saying they kind of dismiss us, but then there's also as you said, the determinants of health, where we do grow up in poor communities without what we need in terms of pediatrician level care for children, for babies, for adolescents, poor nutrition, all of those things. So do you have a gauge of which is the cause the most? Like, is it malpractice against us that is landing us dead and with poor outcomes? Or is it that a vast number of us are in poor health because of societal conditions, or both?
I think there are really so many factors. I think all of those, everything that you just mentioned, they all factor into why we have poorer health outcomes in the United States. All of those things. We have no access to, in our communities, green spaces to exercise. We have lack of access to nutritious foods. I mean, everything that affects your health, there's so much of your health that happens really outside of when you come to the hospital, or outside of when you come to my office. It's really what you bring in. Are you even able to get to the doctor or get to the hospital? What kind of hospitals are in your community, right? There's so many.
That was rural Georgia, right? Where I saw, I was having this conversation with, I think, Latasha Brown some months ago. They did this article about how it was 100 miles to the nearest facility. I mean, and what the heck kind of birthing plan is that?
Right. Not a very good one at all. I mean, and even during the pandemic, we see how telemedicine and telehealth became widely utilized as a means to, because people couldn't go into the doctor's office. And maybe that could be a way we can help to reduce disparities in our communities and in rural areas. But then you come against the barrier of, do people in our community even have access to a smartphone? Right? Do people have access to broadband? And Wi-Fi? Exactly. So the administration also, part of their plan was to expand access, expand broadband in communities, provide individuals with those tools to be able to access specialists and people that might not be readily in their areas. So it really takes a very full circle approach to health in general, and especially to maternal health. And I think, slowly we're chipping away at it. Even just recognizing that access to mental health support is so important for women once they've had babies, and that expanding that postpartum period. So expanding Medicaid so that the postpartum period is now a full year where you have access to care, where you have access to mental health issues. Because that's 6 weeks of the postpartum period, that's nothing, right? That's really nothing. You're barely kind of walking normally after 6 weeks.
Mom of 3 here, let me tell you. that doesn't cut it.
Right. So just knowing that providing that access to people, to providing expanded opportunity to have continuity of care with a provider, makes all the difference in the world.
So what is it, other than the giving more exposure to internet-based, satellite-based services? And I do recall Senator Harris, when she was senator before vice president, was the author of the Momnibus.
Right.
So she has been on the front lines of this, and I'm thankful that she is continuing that and taking that message into the White House. What other things, solution-wise, is the administration doing? And then if you have solutions that you like to see that we don't yet have, tell us what those are.
Yeah, I think the Momnibus has not really in its fullest expression been adopted yet. We're still trying to get that through. It was part of the Build Back Better, which we know got chipped away. And so unfortunately, some things, so like Medicaid expansion, part of that was adopted, but we're really still struggling to get all of those resources to adequately address those kind of global needs of a patient, not really just what's happening when she comes into labor and delivery, when that actual delivery happens. So I think we're continuing to support the administration. I know Congresswoman Underwood is still working to get Momnibus. Probably it'll be in the 2023 cycle. We're 23 cycle. So still really working, because all of those different components of the Momnibus are really critical. There's also implicit bias care in the Momnibus, really supporting education of the people that take care of the community, because Black physicians represent 5% of the physicians in our country. Yeah. And we represent nearly 14% of the population. So very likely a Black person may not even be seeing a physician that looks like them, understands them. And we know research shows that our community does better when we have individuals who take care of us. Black children die at a lower rate when they're taken care of by a Black pediatrician.
Yeah. Yeah, so we had one of the best, Dr. Cheryl, I'm based here in DC, and Dr. Cheryl Edmonds had a pediatric village and for decades. And I was so thankful. It was actually Dr. Sharon Malone, who was my OB, who suggested her. And at one point I had the sweet spot because Dr. Malone was upstairs, Dr. Edmonds was downstairs. All my Black folks, all my love, all my smarts were in one building. Right. But to your point, last week when I had an autism expert from what was the name of it? Something Pratt Center, Shepherd Pratt Center in Towson, Maryland, and he was Black. And I told him, my son is 16 and on the spectrum, and he was only the second Black doctor, autism expert who I had ever seen. So, and I was just looking at him through an IG screen. So, and we know that the numbers are disproportionately high for Black boys, but we're not getting the care through physicians that will basically honor us, Dr. Rachel, is what it feels like to me, like when a mom has concerns, to pay attention to them. So finally, what can we do? Because we know the administration has a role. You certainly, thank God for you, have a role, but as moms, grandmoms, aunties, cousin and them, dads, brothers, uncles, what do we do?
I think we really need to continue to advocate for ourselves in medical spaces, not to be concerned about offending someone. Ask questions. Come in there with your questions. Do your research. I think it's really important for us to be very active participants in our own healthcare. Obviously, you're going to a healthcare professional because they have the expertise, but you also know your body very well, and you need to make sure that you're asking questions. Ask them. If something doesn't seem right to you, if you think you've read about a new technique, right? This is a new technique, doc. How come am I not a candidate for that, right? We know even for Black women with fibroids, we're less likely to be given minimally invasive options. We're more likely to be given options that include major surgery. A hysterectomy could impair our fertility in the future. So we really need to be, and if you don't know that those options are available, then you think that may be the only option. So it is important to ask questions. And if something doesn't feel right, I mean, obviously, like, anybody can have an off day. So if you have an interaction with a doctor and you're like, that seems a little odd, okay, give that person a second chance. But if you continue to have these interactions, if you continue to have interactions where your questions aren't answered, where you feel like you're brushed off, go seek another provider.
Yeah.
Really go seek another provider. Ask your friends who they go see, who they like. Obviously reviews are reviews, and sometimes we take those with a grain of salt, because usually the people that don't like you seem to review you more than the people that may like you. But really, I think it's asking around. I know that I have a list of Black female physicians that I send my patients to as referrals, right? When they need a cardiologist, a dermatologist,
Yeah.
I can refer them to, and I think many physicians of color do the same, because our community wants that. And actually we see our community needs that.
Yeah.
We need to have individuals that are really taking a critical lens to our healthcare, and really understand that there are issues that disproportionately impact us. And are they taking that into consideration when they take care of us? So I think it's very important for us to really hold the medical system accountable, right? When you go see a doctor, and not be afraid to say, you know what, maybe this relationship isn't good, because it is a relationship. Maybe this relationship isn't working, and I may go seek somebody else.
Well, and what I had to do for myself, because in the land of a million appointments that go along with an autism diagnosis, because it affects so many other different areas that people don't necessarily think about, I always had to be thinking about it beforehand, have my list. If I had experts like in my friends and family who could give me the questions, so that I could, because when you're in the office, your brain can start spinning. And as a lifelong advocate in the lawyer lane, I always tell people, if you're going to your doctor and you know you don't feel comfortable talking, you get intimidated, you get frustrated, you panic, take somebody with you.
Bring somebody.
Yeah.
Bring somebody. That is really important. My mother was in the hospital a couple of years ago in the emergency room, and they were like, oh, she's going to get a room soon. Yeah, you can go. No. I stayed, because then they put her, it was an overflow room, and they put her in a place, and she was in not even in a real bed, in the stretcher from the emergency room. Yeah. And I said, well, how is she supposed to get off this high thing to go to the bathroom? Yeah. Right? She would have really broken in the middle of the night, broken something trying to get out of the bed to go to the restroom. Right? Yeah. Things that you really have to advocate for yourself, your family, your friends. It really is important. Very important.
And hospitals, sometimes people don't know, if you don't have anyone, most hospitals can assign you a family advocate. But it's so hard, Dr. Rachel, because how do people even know that they can ask for and get an advocate? So obviously we have so much work to do, but I know that you guys' website has a lot of places where people can start. Can you tell people just how they can find NMA resources?
Yeah, so it's www.nmanet.org. And that's for the National Association. We have different regions. We have our 6 regions across the country, and then local societies in your cities. So very often you'll have an NMA local society taking care of our community. So please contact us if you're looking for Black physicians. We're a great resource. We have 26 scientific sections that represent all different medical specialties. So when we come together for our scientific meeting yearly, we discuss what's happening in our specialties, but we take a critical lens about what's happening in our community, what happens to patients of color. I think that's what makes us very different from other national organizations, is that health equity isn't like a separate part of our organization. It's what we were founded on, and it's thread throughout everything that we do. Everything that we do and how we think, health equity, and making sure that our community is taken care of and taken care of well, that's the priority.
Well, we need you. As I tell every expert who comes on here, we need you on that wall. We want you on that wall. We appreciate everything that you do, and thank you for taking so much time and sharing with us today. Guys, please do follow Dr. Rachel Villanueva at Dr. Rachel Says, and she's also Dr. Rachel Says on Twitter. And you are welcome here with us anytime. Thank you very, very much.
Thank you for having me. I think that these conversations are so important for our community. And so I thank you so much for being a resource and being a voice and being a trusted voice in our community so that we can get the message out about taking care of ourselves and being advocates for ourselves and making sure that we own our healthcare.
Yeah. Yep. We own it. That's
Yes.
right. Hey, thank you, Dr. Rachel. We appreciate
Thank
it.
you. Bye.
Okay. Bye-bye. So guys, I just want you to know that I am so appreciative of us being able to have experts like on our show week after week after week. And I want us to get the message out to others. So, help me, help us. So when we have experts on like this, you get information that you appreciate, tweet about it, post about it. I know that you can't repost while we're on here. You can just do it with individuals, with friends. But as the messages end up going to YouTube, you can share them on Twitter. You can share them on Facebook. We're going to be posting little clips. You can share that information as well, because the goal is to help as many people as possible. The people perish for a lack of knowledge. And I don't want anybody, not one of us, perishing on my watch if I can help it. So help me, help us, so we can help we together. We have another great show for you tomorrow here at noon on Make It Make Sense. Follow me here, Twitter, Facebook, and subscribe, YouTube, Monique Pressley TV. Please give, support us at Cash App, $Mo Press, Business PayPal, Patreon. It's at the link tree in my bio. No gift too great or too small. We appreciate them all as we strive to give you better and more excellent programming. Thanks so much for joining. I'll see you tomorrow. Bye-bye.